Hi everybody, Jessie here from Team IBS Dietitian. Today we are going to do a deep dive on IBS diarrhea. So we'll talk about the three most common type of IBS diarrhea we see all the time, and we are to find relief. But do you know, to find relief, the best thing is to really understand your body. Okay. And all right, I think I see Brooke now. Now, for everybody who's joining us on either Facebook or Instagram, drop down below in comments, tell us where you are joining from and your type of IBS. Yeah, how's some deep dive on? Before we begin, Brooke, you want to share some things on diarrhea? Why is it so debilitating?
Well, it obviously can be very debilitating because of, a lot of times people feel like they can't leave the house, scared to eat because afraid of food triggers, the pain that can be associated with it. It can be really, really hard to manage.
Yeah, and I'm typing in here. Drop us your questions here, and we will do a Q&A. We'll answer Q&A later. Answer Q&A later. Okay. All right, let me pin this. Hi, everybody. Thank you for joining us. All right, so I pinned that, and we can get started. Okay, so let's give people a quick preview which three types of diarrhea we see a lot of in our practice and what we're going to talk about today so they know what to expect. Somebody said, I'm from California. My daughter suffers from IBS. How can you tell what type of IBS she has? We have a free IBS patient toolkit. It's an amazing tool. It's just a PDF printed out. It talks about different types of IBS, what are the diagnostic criteria, what tests you might need from your doctors. That IBS is a symptom, has a symptom-based criteria, but there are also tests that we want to get you tested to rule out other conditions that have symptoms overlapping with IBS. So get a free not symptom toolkit, IBS patient toolkit. If you are on Instagram, you can just comment symptom. I will ask you two questions in your DM. One is your name, number two is your email, and we will email you our patient toolkit. It is very helpful. And then we also have people from Saudi Arabia. Hi, welcome, with IBS diarrhea. That's exactly what we're going to talk about today. Okay, and it's good everybody can hear us. Brooke, do you want to tell us which three types that we see a lot of in our clinic?
Yes, flare-up diarrhea, overflow
I
diarrhea.
can't hear you. Is it
What?
me? Oh, wait.
Oh, wait. There.
Oh,
Sorry, I
yes,
was on
yeah.
mute. Flare-up diarrhea, overflow diarrhea, and food intolerance diarrhea are the three main types of IBS diarrhea.
Yeah. These are very common, and not all of them, of course, are purely diarrhea. So we're going to talk about it. Actually, in fact, two of them are really more so caused by slower gut motility and chronic constipation. So
Hmm.
let's get started. Well, actually, before we get started, we are starting early enrollments to work with us directly for January and February in a few days. So stay tuned. We'll send out emails. We'll also announce on Instagram and Facebook as well. So if you don't follow me, make sure you follow so you can see our post. It will be announced in the post and in the caption. But I'll try to send out emails as well to let everybody know. An early enrollment just means that you enroll in December with 2025 pricing and hold down the spot for 2026. You can start any time with our program, anytime in January or February. So there's a lot of flexibility. If you want to learn more about what working with us is like, go to watch our free IBS Relief Masterclass. It's not just about working with us. The first 45 minutes is really a deep dive on different types of IBS, what symptoms to watch out for, what are some of the reasons for IBS, and what can contribute to making symptom worse, which a lot of the things people do and we see actually make symptom worse, such as cutting out food without knowing what are their own food triggers and also taking supplements. We talk about supplements today too, because that is a question that we are getting a lot of on our Facebook support group. So we have a Facebook support community for women. It's only for women. We actually screen people who request to join. And if you want support from people who are also struggling with IBS, join our community. It's free, it's very safe. Our team, there's 4 of us who are actively reading through everything on there to make sure everything is legitimate, and we try to block off scammers on our pages. So provider-based, evidence-based space for those of you who are women to share your IBS experience, and it's a safe space too. If people are rude, we actually remove them. So don't be rude when you joined. we did remove a few people. Yeah, because they were making people uncomfortable, and it was just not very nice, especially for people with IBS, right? It's a sensitive topic. We really want to be compassionate, have empathy, and very sensitive to what people are sharing. These are very intimate details of their struggles. But anyways, let's dive into the topic of IBS diarrhea. Okay, it's the 3 most common type. Oh, and why does, and as we are talking about understanding the right type of IBS, right? And oftentimes when people get diagnosed as IBS diarrhea, what they don't realize, them and their provider don't realize is they might have IBS constipation, leading them to have diarrhea. Oh, I think Brooke dropped off on the Facebook group. Let me see, on the Facebook video. Oh, let me send you a request. Is it me? Because sometimes it is my problem. But anyways, okay, the first type of IBS diarrhea that we see really often in our clinic, it has nothing to do with food intolerance, but more so because of people's gut motility. So it's called a flare-up type of diarrhea. And sometimes we call it as flare-up diarrhea as well. So that is when patients may get constipated for a few days. There's more and more stool burden building up, and they are not fully evacuating. They get more bloated. They get more pain as they are not fully evacuating. And then all of a sudden, they have a flare-up of diarrhea and all of the stool comes out. And these type of flare-up are not predictable. They make people very afraid of leaving their home because they don't know when the flare-up happens. And it makes it very difficult to live life because these type of diarrhea, they also have all of the other IBS symptoms as well, such as bloating, pain, and just general discomfort. So in this kind of diarrhea, what we actually want to understand and treat is not the diarrhea, because the diarrhea is happening every few days, right? What we want to treat is to resolve to resolve the motility issue that happens in between diarrheas. So I'll give you an example. I think one of our previous clients, her name is Erica. So hearing an example will give you a better understanding of what I'm talking about. So we had a client, her name is Erica. She was diagnosed with IBS diarrhea. She was told to try the low FODMAP diet. She did all the tests, right? She did all the tests. Everything came back normal. Now, you may feel dismissed when you get how did Kim call it? A clean bill of health when you don't feel good, right? So that's very common with IBS. Every test that you've done came back normal. And then the doctor say, you just have IBS. Now go try to manage it yourself and go try the low FODMAP diet. This is exactly what happens to Erica. She would get more and more bloated and have more pain as she get more and more constipated. And all of a sudden she would have a flare up out of nowhere and it would land her in the bathroom for hours. make her really afraid of leaving her house, and also made her really afraid of eating because she was recommended to try the low FODMAP diets by herself without really any guidance or without being referred to a dietitian. And that's the last thing we want to see. That's probably, a can of worms that we're not going to open today, but we will at a different time. But if you've been recommended a diet, do not do it on your own. Always work with a registered dietitian who's trained on helping patients with those diets. But anyways, she was experiencing these bursts of IBS diarrhea. And I think the last straw for her was a trip for her and her husband going to Paris. And she was walking around in Paris. She did not enjoy that trip at all. She was really, really worried that she would get a flare up anywhere. Because as we all know, when you go to visit during holidays or vacations in a new city, you don't know where the bathrooms are. You don't know, you don't speak their language. You can't even ask the people, like, where is the bathroom? And hopefully you can, make it to the bathroom on time. And that's the debilitation, I would say, what Brooke was saying earlier, that people deal with when they have IBS diarrhea. They don't know when it's going to happen. They don't know if they can make it to the bathroom on time without accidents. And a lot of our clients actually come to us. They would bring changing clothes with them. They would bring pads with them. They would wear diapers sometimes, even just to prevent an accident from happening and, really ruining their day or causing more trauma to the already very traumatic experience of having IBS diarrhea. But anyway, so Erica, the last straw for her was her trip to Paris because she couldn't enjoy it. And, it's really frustrating. So she decided to come and work with us. But the first thing we did is not to put her on a diet. Like, she kind of already put herself on a diet. Everybody knows of the low FODMAP diet for IBS, but not everybody needs to be on a diet. I'm going to share with you why using her case. So she already cut out a lot of food, but I told her, don't worry about cutting out more food. What we really want to see is your dietary pattern, your bowel pattern, and your symptom pattern. And what we learned is that when she started tracking her bowel patterns, we noticed that she would go without a full evacuations for multiple days, and then she would have like a bigger bowel movement and sometimes leading to diarrhea, which can last for hours or sometimes even overnight. And in that case, after seeing what her dietary pattern and her bowel patterns are, I told her, why don't we regulate your bowel movements first, right? Let's look at, how much output is coming out. What is the normal amount of stool for you every single day? Let's work on improving your gut motility, resolving the constipation that is in between the diarrhea. And once we did that, her diarrhea stopped completely. Now, here's the thing. If you have a lot of stool built up in your colon, at one point, your body can't take it anymore. Everything comes out. So if that is the case, right, more likely than not, what you have is the flare-up type of diarrhea, which goes back. Sorry, I had something. Diarrhea. You may not have is to improve your gut motility. Fluids, make sure she's hitting her fluid. Goal who helped her create and after doing all of that, in the morning after eating her breakfast. And she didn't have any more on the low FODMAP diets, but when she came to us, while we didn't cut out more food, we still maps group by group. Brooke, that looks like. So 12 groups of FODMAP have any food triggers. can hope for when you have IBS. Because start cutting out a lot of food. But needs to cut out food because not I had significant IBS-C. Died. Me and my husband, we both have IBS. The love of my bride, and it is really afraid of food. And that she did not have any food triggers when we of the FODMAPs. Yeah. So we have 11 groups of FODMAPs and FODMAP subgroups. So that's the low FODMAP diet, right? The low FODMAP diet is
Mhm.
not cutting out all FODMAP foods for a long time, but temporarily cutting things out and then doing a reintroduction of each group. And for each group, we do a reintroduction over 3 days and monitor symptoms for another 2 to 3 days after that to see whether somebody tolerated that or not. But anyways, for the flare-up type of IBS diarrhea, more likely than not, patients don't have a food trigger, but there are types with IBS mixed within IBS mixed bowel type that people may have a food trigger, which we are going to talk about next. So today we are talking about different types of IBS diarrhea. So the first one we just talked about is the flare-up type of diarrhea. Do you have anything you want to address? Did I miss anything?
I don't think so. Um,
Yeah, I think I didn't really say the common signs of flare-up type of diarrhea. So usually people go without a full evacuations for a few days and stool
mhm.
build up. They feel more and more backed up, more and more bloating. And everything comes out when your body cannot hold it anymore, and a large volume of stool comes out.
Mm-hmm.
And the I say the ID parts, the key to see whether you have the flare-up type or not is whether the cycle repeats itself after
Mm-hmm.
that. And that's something, that's the telltale sign of, hey, this is the flare-up type of diarrhea, IBS diarrhea / IBS mixed bowel type. Then we really need to work on motility to improve your motility.
Mm-hmm.
And we do see some people with this that have food intolerance as well, which we'll talk about in the next, on the third type of IBS diarrhea. So, okay, nothing else to add. Do you want to talk about the second type of
Yeah, so
IBS diarrhea? Yeah.
sure. The second type of IBS diarrhea is overflow diarrhea. So what that means is you're actually have a fair amount of constipation, so
Oh,
built up
hold on.
stool.
People were saying it's cutting in and out for me. I am so sorry. Brooke, can you hear me okay?
Yeah.
Was I cutting in and out?
Mm-mm.
No? Okay, good. And you're listening to it on Instagram, right? Or are
I
you
am
listening
listening
to
to
it
it on
Facebook?
Facebook, but I can see you on
Okay. Oh, I
Instagram.
am so sorry that is happening. So maybe we can download the Facebook video after this instead
Mm.
of the Instagram video. All right. Anyway,
Um, that's okay. So overflow diarrhea is when there is hard backed up stool in the colon, and then newer stool, because there's such a backup, actually the liquid stool goes around that backed up stool. So that can be common signs would be frequent watery bowel movements all day, maybe small amounts too.
mm-hmm.
Strong urgency to go. A big one
I
can be
wanna,
feeling of incomplete evacuation. So even though you just had this watery diarrhea, you still don't feel fully evacuated. Yeah, so this is the
yeah.
where the
Oh,
stool's all built up. Yeah.
we
Um,
have a, yeah. Okay, we have a post. Let's do this one.
oh
We
yeah.
have a
Yep.
post, as you can see, there's stool burden build up in here,
Mm-hmm.
but then your body will still want to go to the bathroom. And when it tries to have the contraction in the colon, only the watery and the liquidy part comes out. And usually people
Yep.
get multiple smaller diarrhea per day.
Mm-hmm.
Okay.
You can also have constant bloating or pressure. And a lot of these people will carry extra clothes or diapers or things like that in case they have an accident with that liquidy stool.
Yeah, let me ask to see for people on Instagram, can you let us know if there's still problem with our sound going in and out? Is it just me? I think it was just me. Okay. Anyways, all right, let's keep going. Yeah, with the overflow diarrhea. So what can help with overflow diarrhea?
So what we really want to do is clear out that blocked stool. So soften that stool and actually pass it. And then that is really going to stop that overflow diarrhea because it's not going to have to leak around the side of the hard blocking stool in there.
Hmm.
So other things that can help are avoiding medications that might slow down your motility, which sometimes can be easier said than done, but we can, so there are some medications that slow down motility. Um, and then identifying what else might be slowing down your motility. Is it a food intolerance? Is it pelvic floor dysfunction? Uh, Things like that that might be contributing to the constipation. But also sometimes once we get rid of that harder stool, things get back to normal pretty quickly, but then we want to make sure that, your diet is in a good place with fiber and fluid and all those good things to maintain good motility.
Yeah. So with overflow diarrhea, one thing I think Brooke keeps saying, and also a very key is motility, right? We really want to
Mm-hmm.
prevent the constipation from coming back. Most likely is there's a change in motility causing the stool burden. And for stool to be impacted in your colon or rectum, it probably has been there for a long time. This is not a problem that showed up yesterday. And it's also not a problem that will resolve overnight. And usually it takes, well, the diarrhea might be resolved overnight once the blockage is removed, but the gut motility is the part that can take a long time to build back up. And remember, it's not a quick fixes. And actually, sometimes we see that, we really, once we resolve the blockage and the diarrhea, we see that patients have significant slower gut motility, and we try to understand what is causing the significant slower gut motility. And sometimes it's contributed by a food trigger. One of our one-on-one clients, this is a one-on-one client, not a group client, but this lady, she is one of the smartest lady I've ever known. She's an entrepreneur. She actually had a startup. She was the CEO of a startup, and she came to us with significant diarrhea. She was recommended to join a program by another dietitian. And when she joins a program, she reviews the modules that we have, and she sent me a very long message, and she said, Jessie, for years, I've been dealing with IBS diarrhea for years and years and years. I went to all type of doctors, my PCP, multiple GI, functional doctors, naturopath, went to multiple dietitians or nutritionists, and nobody could help me resolve the diarrhea. And she was, of course, put on medications for diarrhea as well, right? However, she said, as she was reviewing the module, she said, we are treating the wrong symptom. What I had, and she told me before I even have met her, is that I have overflow diarrhea. I have the liquidy small diarrhea that you're talking about in your video. And that's why none of the treatment in the past has worked. So they've all been treating her for diarrhea, when in reality, we should have been treating her for constipation. Because once we resolve the constipation, her diarrhea stopped. But her motility still have
So
issues.
Jesse,
And what her problem was that when we did the elimination diet and reintroduction is we found that she was, oh, I think you're back. I think you were frozen just now.
yeah, I was frozen.
But anyways, when we did the food challenge, we know that she had a food. Once she eat it, it slows her gut down significantly, where she wouldn't even poop without laxatives. Now, I think she actually left us a Google review as well. That was amazing. But for her, she knows what her food trigger is after working together. Actually, in the past, she was just afraid to eat. She was afraid to go out. She was afraid to eat because she had overflow diarrhea, right? She was having multiple diarrhea throughout the day. She doesn't know when or where it's going to happen. Now, remember, this is this is somebody who is very successful, very smart, and she couldn't figure it out. And her doctors couldn't figure it out. And that was what was surprising. But for those of you who are listening, what we are trying to help you to do is to really understand your body knows what may be contributing to your symptoms. What looks like diarrhea may not be diarrhea. It could be something else. It could be caused by slower gut motility. And for the past two types of diarrhea that we're talking about, these are caused by constipation, caused by slower gut motility. And what these cases, right, these types of diarrhea, what you really need to work on is improving your motility and finding and understanding what is causing the slowdown in the motility, and also work on the dietary and lifestyle changes that can support proper gut motility. Yeah. Okay. Anything else to add on overflow diarrhea?
I want to say too, getting rid of that blocked up stool may take several days to a bit longer, depending on how much stool is built up. So it's not just a one bowel movement and you're done kind of a thing, usually.
Yeah, absolutely. And for those of us with significant backed up, your body really likes to withhold stool. My body too. Okay, I'm IBS-C. Like, if we have the tendency in our colon to withhold stool, if you don't work on other modalities to improve your gut motility, that will come back. Constipation will come back. But the hope is once you understand your body, the blockage doesn't come back. Once you see
Mm-hmm.
signs of constipation, you know how to resolve it before it snowballs into a blockage, into some impacted stool again. So don't give up. There are so many different ways to help you improve motility and help you resolve these two types of diarrhea. Okay, we're seeing some questions come in. We'll get to questions in the end. Can that be due to colonoscopy and endoscopy? No, scopes do not cause worsening of symptoms. It may
Mm-hmm.
cause temporary change in your gut microbiome, but our gut is pretty resilient. It usually rebounds fairly quickly. Now, we cannot speak to individual cases because we don't know the medical history, also what happened during the scope, but no, it does not. Scopes are very safe for the most part. And all of our clients, actually, all of our clients have had scopes done, which is can be important if your IBS symptoms do continue to worsen. Okay, should we? I really like what you said about the talking about the blockage because
Mm-hmm.
the goal is to preventing that blockage from coming back.
Mm-hmm.
Now, the last type of IBS diarrhea, which is actually something we see very often, is the food intolerance diarrhea. We did a video, I think a few weeks ago, was it? That we talked about different types of IBS food triggers. And there
Mm-hmm.
were 9 types. Now, you may think I'm talking about the FODMAPs. No, FODMAP is one of the types, but there are a total of 9, not a total, but there are 9 types that are more common in the IBS population. FODMAP is one of them. We talked about all of them in that video a couple weeks ago. I want to say it's the week before Thanksgiving that we did that video, 1 or 2 weeks before Thanksgiving, but you can scroll through. You can go on YouTube to look for it.
Mm-hmm.
If you search IBS Dietitian, our videos should show up. Then look for the videos for IBS Community for Women. It is uploaded there. I think it's definitely on YouTube. I just can't remember how to. I don't know what's going to show up on your YouTube because I'm sure our algorithms are very different. But you can watch it on YouTube or you can watch it on Instagram as well. You just have to scroll back a few weeks.
Mm-hmm.
Okay, the last type of IBS diarrhea that we want to talk about is. Do you want to share that?
Sure. Food intolerance diarrhea. So this is diarrhea that is directly triggered by a food. So it usually will happen within minutes to hours of
Mm-hmm.
eating. You usually get gas, bloating, and cramping, and you don't have constipation beforehand. So it's pretty much all diarrhea all the time. And we are usually sure that there's no constipation that goes along with it. Some common signs would be urgent diarrhea right after or soon after meals, feeling completely empty after each episode, and diarrhea would return with the next meal or the next time you eat that trigger food. And there's a clear food related pattern. Sometimes we see people that can eat the same food. They're fine one time, the next time they're not fine. That would not be food intolerance unless there's a variation in the food of some sort.
Yep. Yes, and it depends on what food it is, right? Some food, oh my goodness, sorry. My kid came in. The
Oh, I
door
can't.
just
We can't
slammed.
hear it.
You can hear that? Okay,
No.
good. But it just like scared me because they slammed the door. But some foods, it depends on what type of food trigger it is. Like what you
Hmm.
were saying, some can happen within hours, some can show up like in a few days. It really depends on what type of food it is. For example, right, FODMAPs usually shows up maybe between 1 to 3 days. It depends on what type of FODMAP. Well, even within FODMAPs, there are different types of FODMAPs. If it's the osmotic ones, it can show up a little bit faster because the
Hmm.
osmotic action happens in your small intestine, and that could be, within a few hours of eating the food, then it starts drawing fluids into your small intestine and then diarrhea happens. But if it's more of the fermentable FODMAPs that doesn't have the osmotic function, then it can happen, maybe 1, 2, 3 days later, depending on your motility, right? The speed of your motility, which we learned that everybody is a little bit different. And then also some people may not tolerate, FODMAP is one type that we see very often. And if you do suspect FODMAP is your food intolerance, right? Know that you don't just cut out all of the FODMAP food. You do what do we say? We do a short-term elimination diet because the low FODMAP diet, let's talk a little bit more about the low FODMAP diet because there's so much misinformation about it. I had a meeting yesterday with a company. I'm consulting on a project in creating a toolkit for patients. And of course, there's a dietitian, there's a GI, there are public health, like PhD in public health in the group, and there are also other people in the group as well, patient advocates in the group. And whenever it shows up, like IBS diet shows up, people automatically say the low FODMAP diet, how to help patients eat the low FODMAP diets. And I think there is a general misunderstanding of the low FODMAP diet. It is not a long-term diet. And it's kind of sad because it really causes a lot of struggle in patients when they think that they have to get on a diet for a long time. They have to cut out all of these foods for a long time. And the reality is that is not the case at all. In fact, when you stay longer on the low FODMAP diets, and not reintroducing it, it can change your gut microbiota. And when that change happens, it can make you more sensitive to the FODMAPs group that you are eating. Sensitivity to these FODMAP groups, it can make it worse when you eat these FODMAP. Timer thing that tells me, hey, you've done your 45 minutes of social media today and you need to get out of social media, for our mental health well-being, right? For those of you who are listening as well, beware of how much time you spend on social media and always follow evidence-based providers. If you are getting, you're learning more about medical conditions or what to do for finding relief. And you can hear, for those of you who have been joining us from the beginning, we have not recommended any supplements at all, right? A lot of people will jump on and start talking and then they will start recommending supplements. Beware of those people. They're here to sell you something. I mean, we do promote our service, but we don't promote any supplements. And well, that being said, I do have a giveaway coming up with a partner tomorrow, with a partnering company tomorrow. That is a supplements company to help people eat more FODMAPs. Oh my goodness, I feel so okay. We only ever partner with people that we believe have integrity and also have evidence. So we don't just promote anything, and we won't give you a code for discount. That's something I don't do. I know some of the other dietitians do affiliate codes, but I don't think having, I think that's conflict of interest, even if it's a very small amount. But anyways, let's go back to FODMAP diet. Sorry, that screen pop-up just, what is that?
Distracted you.
Distracted me, and now I couldn't go back to it. But anyways, there is huge misconception about the low FODMAP diet. It's not a long-term diet. And we know because research have shown that if you stay on it for longer than 8 weeks, we are starting to see a change in gut microbiome. Now, is it a good change or a bad change? We don't know that. I mean, we just don't know enough about the gut microbiome to say what is good, what is bad, how you can change it to make your health better. Well, actually that we do know, but there's only one way, and that's by eating more variety of food. So we know that for certain, cutting out more food is not the way to improve your gut microbiome. And we know improving gut microbiome, what it means is increasing the diversity of the microbes in your gut and also increasing their health, right? So giving them substrates to break down. And that, what I mean by that is prebiotic fiber. And that is what exactly FODMAPs are. FODMAPs are prebiotic fibers that feed our gut microbiome. So we know people who get on the low FODMAP diets for a prolonged period, they actually have decreased good gut microbiome. There is a shift. We don't fully know the scope or impact that shift will have. But what we know is there is a shift, and more likely than not, the microbes that can help you break down the FODMAPs will decrease in amounts because you are not feeding them the fiber they need to thrive. So even the low FODMAP diet, we always say that in our clinic and in the GI dietitian community, is that none of the diets are benign. It always takes a toll. One, on your mental health, right? Having to cut out so many food. Number two, it also takes a toll on your gut microbiome as well when you're cutting them out. And I presented to dietitians this October at our dietitian conference, Fancy. And one of the things I have to really emphasize on there is that if you are a dietitian who is not specialized in elimination diet, you should not be teaching any of these diets because it can do long-term harm. It can cause people to have, change in your gut microbiome, nutrient deficiencies. It can cause people to have disordered eating behaviors, and it can cause people to have eating disorders. People could have the best intention, right? A dietitian could be like, oh, I heard that the low FODMAP diet is good for IBS. So a patient go to a diabetes educator, for example, to be like, what should I do for my IBS on top of my diabetes? And the dietitian be like, why don't you try the low FODMAP diet? I'm like, no. If you don't know the diet, do not put anybody on it. Diets are not benign. So for those of you who are listening, I actually want to hear from our audience. Let us know in comments. Have you heard of the low FODMAP diet? Have you been on the low FODMAP diet? And how did it work for you? And while you do that, Brooke, will you talk a little bit about the process of understanding, whether somebody has a FODMAP trigger or not, and how long is usually the process?
Yeah, so the elimination phase of the low FODMAP diet is 4 to 6 weeks. If you have not shown pretty significant improvement in the 2 to 4 week range, you probably don't need to keep continuing the diet. It's probably, we need to kind of go back to the drawing board and do something else diet wise. So once you've done the elimination phase and your symptoms have improved, then we go very systematically through the FODMAP groups and do 3-day reintroduction there's specific amounts for each day, but it's basically a very small amount, and then kind of a medium amount of the food and see how you tolerate it. And then we just work our way all the way through those groups and then create a customized kind of plan for you with the FODMAPs you can and maybe not tolerate. And usually we don't see people not tolerate more than a couple groups. And even if you can tolerate a small amount, we'll have you eat that small amount and then retest groups again several months later to make sure that we can liberalize your diet as much as possible.
Yeah, and I want to kind of show everybody too. This is what a FODMAP challenge look like. You have to eat specific food with a specific amount for the 3-day challenge to happen. And then we can record your symptoms and see whether you tolerate it, day 1, day 2, or day 3. If you tolerate day 1, right, you keep eating that small amount to feed the gut microbe that can help you break down these FODMAPs. And usually what we tell patients is in 3 to 6 months, do the challenge again to see if you are able to, move up a group or if you're able to tolerate the full surfing of that FODMAP group. So this is the excess fructose group. There's a total of 11 groups in our program where we help patients do the challenge and understand where their tolerance level lies. And what were we saying? Yeah, it's not just yeah.
Just the FODMAP elimination. Yeah.
Yeah. Oh, somebody here is as an eating disorder dietitian who supports people with GI, MCAS, and hypermotility. Elimination is not a real option. We manage stress first. Thank you for chiming in because we have somebody who said their daughter might have an eating disorder because of the GI issue and feels overwhelmed. If it is the case, usually we recommend working with GI psych and also an eating disorder dietitian to help you build the confidence first. We don't work with eating disorder. We do see some RFID cases, but what we do is we really help them reintroduce food as fast as we can. But if it's a true eating disorder, you want to work with somebody who has GI and eating disorder experience because, supports and, tiny little step, to get the support and then move tiny little steps forward is the key. But what we are really trying to achieve here is tell people that, hey, you don't have to be on low FODMAP forever, and it's not the intended goal. Even with Monash University, who developed the diet and also trained dietitian on the diets, the guidance is 2 to 6 weeks on low FODMAP, and then you do the reintroduction. Now, let's talk about what we do when patients are on the 2 to 6 weeks, right? We rarely put people on a full low FODMAP diet anymore, but sometimes, if that is the case, but most of the times we just remove a few foods that we think is triggering symptoms for the patients at the moment of working together. But Brooke, do you want to kind of talk a little bit about what we do during the elimination? Because during the elimination, symptoms are a lot less because you are removing gut irritants. Yes, some FODMAPs are gut irritants, and we are removing some of it, but it's not the full story. When you're on the low FODMAP phase, when you work with an experienced dietitian or physicians who put you on this diet, we are actively digging deeper to see what's going on. Yeah, Brooke, sorry.
Yeah, so we'll do lifestyle challenges each week. We have a whole list of lifestyle challenges that we do with people. A lot of vagus nerve lifestyle interventions to help stimulate the vagus nerve. We work on making sure people have enough hydration, a balanced diet, that they're getting fiber at each meal. Sometimes we play around with insoluble versus soluble fiber. Sometimes that can be helpful. But really, since we are seeing everyone's what they're eating and their bowel movements, we really get a very in-depth view of what's going on. We'll also talk about sometimes exercise, really the whole picture of everything that's going on, and kind of tweaking things and making their symptoms or reducing their symptoms so they're back to a normal
further
life.
Reduce their symptoms.
Yeah.
And I think one of the things too, right, when people are on low FODMAP, we also look for signs. When we are talking about overflow diarrhea or flare-up diarrhea, we look for signs of those as well, because when there's less things irritating your gut, right? Because FODMAP, some of them do draw fluids into your gut and causing people to have more runny stool or loose stool. So when we are reducing the FODMAP load, we can see better what the baseline symptoms are and what may be triggering all of your symptoms. Because if you don't resolve, right, I hate to use this word, but the root cause, I hate to use these words because in the functional alternative space, it could mean something very different. But in what we are saying, we're talking about what is really going on in your guts. And this is usually sometimes what we find when people have really slow gut motility, leading to significant constipation, causing a flare-up or causing overflow diarrhea. If you don't understand, what is truly going on, the underlying cause of your symptoms, when you reintroduce FODMAPs, you're not going to tolerate it very well. For example, if you have overflow diarrhea, right, you temporarily reduce your FODMAP burden, but you don't resolve the backup. You don't resolve the blockage in your colon. You can still have a lot of pain. You can still have bloating. And when you try to reintroduce the FODMAPs, the overflow diarrhea might come back. So when I say investigate the root cause, right? We are trying to understand what is ultimately going on in your guts to help you, find a long-term solution and not just tell you to cut out food, reintroduce food, and then see where you tolerate. So you have to resolve the root cause. And also what Brooke was saying, what we do with our clients too is a lot of the making modifications to diet to lifestyle and finding something that truly works. And we also talk about, creating a routine as well, which is bowel routine to help people have better evacuations every day, or, better evacuations and times evacuations, understanding when your body, is at a better state of having that full evacuation every day before you get on with the rest of your day. And, with food intolerance, though, you do have to do the elimination and then do the reintroduction. Now, it may not be FODMAPs, which is what we talked about in the previous video. We talked about 9 different types of foods that can trigger diarrhea. So non-celiac wheat sensitivity is something we see very often as well. Sometimes we can see people have EPI, which is exocrine pancreatic insufficiency. We actually have a client who is on, who since working with us, we've done so many things with her, and she is on a pancreatic enzyme replacement therapy. These are prescription medications. Do not go and buy things that you don't know, okay? Talk to your doctor, okay? Or work with somebody who understands. And sometimes it could be bile acid malabsorption causing burning diarrhea. So these two are more triggered by higher fat intake in your diet, but you don't have to just deal with the diarrhea because there are great medications that can help. When she actually came to us, we suspected bile acid malabsorption first, and her doctor suspected that as well and put her on a bile acid sequestration, which is a medication for bile acid diarrhea. It actually made her diarrhea a lot worse. Whew. It was really bad. But now, but we looked at what she was eating. We determined that it's not the food causing her diarrhea. And we said, since you started taking this medication, things got a lot worse. And when we say a lot worse, this is when Imodium is not even working. Okay. And that's how, and that is how debilitating diarrhea can be. But anyways, we got her off of that. We tried to continue to manage with diet. She was better. Her diarrhea slowed significantly, still have some loose bowel movement. And now we are doing other kind of trial with her physician. So we're doing pancreatic enzyme replacement therapy. We help her, we recommended a medication. We help her dose the medication. Usually dietitians picks up on these a lot faster than doctors because we are seeing the full picture. We are seeing what the patient is eating, what their life is like, and what their bowel movement actually looks like. At least in our clinic, that's what we do. We have our patients document all of her stool pictures so we can get a better understanding of what type of stool they have, if there's things floating on top, what the color changes mean, all of that to recommend something. And now she is in a much better place. So that's another type of food triggers that could be causing IBS diarrhea. What else did we talk about last time? Oh, the sugar alcohols that can trigger IBS diarrhea as well, and excessive alcohol intake. Oh, probiotics is one that we wanted to talk about. Actually, in our Facebook group, hi Facebook, in our Facebook group, there were a lot of questions on supplements. With probiotics, be very careful because probiotics is strain specific and strain specific to your symptoms, okay? IBS subtype and also IBS symptoms. You want to take the right strain for the right symptoms. And in our program, we don't have a lot. We don't recommend a lot of probiotics, and we don't recommend anything long-term because we don't have long-term safety data. And we know that from working with patients and also talking to our audiences on the internet, we know that most people who try probiotics have experience significantly more diarrhea after a while. And sometimes they have SIBO after trialing probiotics. So be very careful. Even if your doctor puts you on a probiotics, here are a few questions to ask your doctor, right? How long do I need to take this probiotics for? What symptom change am I looking for? Because you need to know, when you do an intervention, what change are we looking for? When do I stop? What are the adverse events that can happen? I think there is a gap between doctors and probiotics as well. They think, oftentimes what we hear from patients is, oh, my doctor told me just to go pick one from the store. I'm like, Okay, no, do not do that. Okay. Um, we have a podcast episode all about IBS probiotics. And my dear friend who is an IBS dietitian, she did a deep dive. She did a deep dive on all the different strains and the research to create a chart. I can't remember the website name, but there is a website that she created. I think it's IBS Probiotics. And she put together a chart to help people better understand what type of probiotics can potentially help with what symptom. Remember, it's not just your IBS type. It has to be symptom specific, right? Some of it helps with diarrhea, some of it helps with bloating, some of it helps with constipation, but don't stay on it long term. Work with your provider when choosing a probiotics and also when implementing a probiotics. We don't recommend anything long term, and in fact, we only usually put people on one that we like for only 7 days to see if, it helps. We have people stop because even the best kind out there can give people SIBO.
So
And SIBO is
she
small intestine bacteria overgrowth. And we are actually going to do an IG Live to talk about that next week for those of you who might be interested. Yeah, what you were saying?
Bailey founded ibsprobiotics.org.
So go check out that website, but also listen to our podcast episode about probiotics and IBS first so that you better understand how to use that site, because it's not like, okay, I go on there, pick a probiotics and take it forever. No, don't do that. Listen, learn more about using it, because it is one intervention. And it is not a benign one because people can have long-term consequences. We have seen a lot of SIBO patients from taking random probiotics that were, recommended to them sometimes by their physicians, but a lot of times by friends and family or what they see on the internet, and also naturopaths, which if your provider recommends like more than 5 supplements, you should probably run. Okay, be careful. Supplements are not needed to manage IBS. Oftentimes, understanding the food triggers and understanding lifestyle triggers is sufficient in managing IBS for good. If you want to learn more about our process in understanding food triggers and understanding lifestyle triggers, go watch our free IBS Relief Masterclass, where we have the slides to show you what we are talking about here and really understand, what type of food can trigger symptoms and how to identify it, and also and lifestyles that can be helpful. Lifestyle modifications that can be helpful. We call it lifestyle triggers in our program because people will be like, okay, after I worked through this challenge, I noticed that my symptoms got better or this and that happens. And then we know that lifestyle change is a trigger for the person. But go watch our free masterclass. It's really, really helpful. You can always comment class at the bottom to watch the masterclass. We were talking about early enrollment just now for our January and February small group VIP program. Early enrollment is starting in a few days, and we are doing the discount. When you watch the free masterclass, you get a discount code at the end that takes $500 off when you join our program. We are still running that discount until sometime in December. Okay, my brain is blanking. I am so sorry, everybody. I should know this. Let me see if I have it written down somewhere. I think it's the 20th, but don't quote me on that. But anyways, you still, if you join now or the next few days, you still get $500 off working with us in 2026. Yeah, I think it is the 20th. And then in 2026, unfortunately, because of inflation, we are going to have to increase the price of our program. But we do offer buy now, pay later, and we do offer financial aid for people who need it. So go to our website to learn more. You can apply as well. So that's, we are trying to do the best to survive as a small business in this economy. I think we will survive. We will definitely survive. And we are offering ways for you to lower the payments if you want to work with us, but may not have the means right now. Okay, let's go up to questions. Somebody said, Dr. Pimentel's low fermentation diet is working better for me as I age. I did the low FODMAP years ago with a dietitian trained by Kate Scalata. Okay, yeah, here's the thing, right? We talked about this earlier. When you do the low FODMAP diet, it's not just about food. It's really about understanding what is going on in your gut, what's triggering your symptoms. If you don't resolve, and I will have to say this, all of our clients tolerate more FODMAPs after working with us than when they started. So low FODMAP is not just about elimination. It's about understanding what is going on, resolve the root cause, and then reintroduce FODMAPs. Well, I guess that the low FODMAP diet is only one part of the formula. It's not the full formula. Remember, diet is only one thing. If you don't understand what is triggering your symptoms, you get stuck eating these very restrictive diets. Dr. Pimentel is great. He really explored so many things about SIBO. However, I do not agree with him on diet because the low fermentation diet is a long-term diet. There's no reintroduction. It's extremely restrictive, and we are talking about restrictive in the long run, right? We are going to talk a lot about SIBO next week, but we also have a podcast episode about SIBO if you want to go listen and learn more about how to manage SIBO and how to resolve your SIBO symptoms so you can bring more food back. SIBO does not mean a life sentence on restrictive diets. I just want to say that out there because that's often what people are told to do. And we have a client actually right now who came to us for SIBO. Oh, she is SIBO free. Yes, I'm thinking of Jennifer. She came to one of our clients. She came to us for SIBO. She's actually sweetest lady. Poor thing. She did, I think she did antibiotics treatment twice, and she still had symptoms. She did the Ambiota diet, which is elemental diets. That is when that's when usually when patients get treated for SIBO and their symptoms don't improve, it comes back, then they are recommended to try diets, thinking that diet will work. Oh my goodness, when she was drinking the shake, she went from extreme constipation to having diarrhea multiple times a day and a lot of urgency. It did not work for her. And when she came to us, actually, we're still working together right now. When she came to us, what did we do with her? We helped her transition out of prescription medication to over-the-counter laxatives, and she actually has a lot better evacuations now. And she was also recommended the low fermentation diet. She asked, before she joins our program, she asked my opinion on that. And I told her, no, you don't need to be on the low fermentation diet. We do not ever recommend that. Low FODMAP diet, it's very similar to low fermentation diet. It's less restrictive. And not only less restrictive, it has a reintroduction phase to really understand your own personal tolerance to each groups of FODMAPs so that you can eat those groups of FODMAPs again. And so she asked my opinion on that. I told her, don't do that because you can get stuck long term and become very afraid of food. And she has already started developing some food fear. And when we started working together, we identified that she might have a different types of food intolerance, which we helped her remove that food. We actually liberated her FODMAP diets a little bit more because she was more restrictive when she joined. And her symptoms are way better managed now. And she did her SIBO breath test again after working with us with her GI. And she's SIBO free. This is always like triumphant cases. Now, after the holidays, we're going to have her reintroduce all the FODMAP groups one by one to see where her levels are to each group of FODMAPs. But my hope is, and my expectation is she will be able to tolerate all of the FODMAP groups and will be able to eat them when her SIBO has been in remission. And that's always the goal, right? The goal is not to put patients on a diet long term because it has mental health impact. It impacts your gut microbiome as well. And for most of our clients, all of them can't eat FODMAPs again safely or eat the amounts that they can tolerate safely so that they can expand their diets and they don't have to worry so much about symptoms. So That's something for those of you, to think about if you've ever been recommended a diet. None of these diets are benign. None of them should be long-term, except if you have celiac or non-celiac wheat sensitivity, right? Then you have to be on the gluten-free diet. We do put people on the gluten-free diet when we suspect that they have non-celiac wheat sensitivity. Every time we have to recommend somebody to be on it, I think our heart just breaks a little for the person because it is a very difficult diet to implement. It's a steep learning curve, but once you get over the hump, it will become a lot easier. Okay, one of the questions we get about working with us is if we work with other conditions as well. We work with inflammatory bowel disease as well. One of our past clients, Lauren, she was on our podcast. Actually, we have a Lauren on our podcast talking about working with us with IBD, inflammatory bowel disease, and IBS. And we also had another past client on the podcast talking about her SIBO experience with us. So this is Dr. Laura. So Lauren and Laura, go look for the episode and listen to their story. I think we are really grateful for them to come on and share their story because it's not just talking about our service, right? It also talks about the struggle that they had to deal with. Laura, who is actually a PhD herself and a healthcare provider herself, she struggles with diarrhea for 5 years. Was it 5 years? Yeah, 5 years. And she worked with her GI and tried to figure out her diet on her own. And she couldn't. And she was really struggling. And she felt very lonely and isolated. But go listen to the podcast for her full story. In 4 months, we resolved her symptoms. And she was able to go to Croatia for 3 weeks, traveling, eating everything she loved, doing all the touristy things without worrying to have to run to the bathroom for her diarrhea. Because when she came to us, she was even afraid of driving to work because of her diarrhea. So for those of you who struggles with IBS diarrhea, I just want to say don't give up. If you're worried about, having accidents in public, which is some comments that we get a lot on my profile, it is okay to use tools to help you prevent, a traumatic events from happening. Like a lot of our clients, they bring pets with them. They wear diapers, they bring extra changing clothes. They bring wipes, to just get themselves clean up. When you have these tools with you, you are less anxious, you're less likely to have a flare-up. But even if you do have a flare-up, right, there are things you can do to mediate the problem. But of course, the goal is always to identify what is going on in your body so you can resolve the IBS diarrhea for good and take your life back from IBS. So, okay, that's it from us today. Do we have any other questions? I think we are good. And so good to see everybody. I hope to see you again soon. Next week, we are talking about SIBO. And early enrollment for our program it's opened in a few days. And tomorrow, we have a giveaway coming with a company that I love. Okay, so stay tuned. And thank you, everybody, for joining us.
Bye.
Bye.